Hello and welcome to Alive with Amanda. So, a question I see all the time, especially in Facebook groups, is why would a licensed person want to join a group practice? And there are a ton of reasons for that. I'm going to talk about caring therapists, and I promise this is not a video to sell you on coming to caring therapists. I just want to tell you what we've seen. And so, the number one reason why I think people come to caring therapists is our reputation, right? And so we have a great reputation for a variety of reasons. But the number one thing that we can offer to clinicians is referrals. Okay. So that's the bottom line. When somebody joins us at Caring Therapists, and especially if they work evenings, they work with children, or they work with couples, we can fill them up probably before they get started. Okay. We actually hired somebody to work Saturday and Sundays, I think specifically with children. They were full before they even started. We get a ton of referrals. So if anybody's ever wondering, this is like a trade secret. That's not really a secret. The reason why Caring Therapists has been so successful is because of the number of referrals that we get. That's just it. I mean, that's it. We are able to keep people full to the extent that they want to be full. We're able, if people have holes in their schedule, generally fill them. Yes, there's some caveats to that, like, the 10, 11, 12 o'clock appointments, sure, those might stay open. We have a harder time filling them. And especially people who only work with adults, or don't work with children, don't work with couples. Sure, that's a little harder to fill. But generally speaking, we run a very tight margin of how many appointments we have available every week. And we almost, if we have 100 appointments available, we almost book 100. It's very close to that. We get like 200 inquiries a week. We have 100 appointments available, and we schedule 100. So it's really a very, very, very tight margin. Those are rough numbers, but you get the idea. And so a licensed person can make what is pretty good money with our practice, and they are able to come. Their schedule gets filled. They don't have to do intake. They have to do an intake, but they don't have to book the appointment, right? So they don't have to spend time getting the insurance, verifying the benefits, selling the person on the phone, which takes 15, 30 minutes. Like, let's just say it takes 30 minutes between doing all of the steps. They come in, bam, they've had no time. The schedule is up. They see their clients, they write their notes, they leave. There's nothing else that they have to do. They don't have to even run the credit cards. We run the credit cards for them. They don't have to bill. They don't have to hit submit. We do that for them. They don't have to follow up with claims if a claim gets denied. We do that for them. And they don't have to, at first, if the credit card gets declined, they don't have to ask the client for a credit card. Now, if a credit card goes declined, and our billing team has called and sent an email and sent a PayPal link and sent an invoice, sure, we're going to ask the clinician to help us. Why? Because the client's avoiding us and they're seeing the therapist. But for the most part, they don't have to run down anything with billing. They don't have to worry about, like, if their couch breaks, they have to spend $500 on a new couch. They don't have to worry about filling their schedule. There's a lot of things that we take the worry away for people, right? We are very upfront about how much insurance reimburses us, what they're going to be paid, what percent they can expect people to cancel, maybe what percent we're not going to be able to collect. There's just some numbers in that. They don't have to worry about their credit card, processing fees, billing, et cetera, et cetera, et cetera. And so, and because we offer employment, they can get a 401k matching, which we're just right there to offering. There's just been some administrative paperwork issues that we've been dealing with, but that is a part of our plan, right? We have health insurance. We'll pay for some CEUs, and we have a really supportive environment. We do supervision. We do outings. We do holiday parties. We do all the things that, they say to do. And we try to pay at the top end of what a therapist in a group practice will pay. So we try to hit all of those boxes. We don't pay less than other people, and we don't offer less than other people. Granted, we're very large, so we're able to offer a lot, but I've always tried to offer a lot. I always paid at the top end right from where I started. And honestly, when I first started my group practice, I wasn't making any money for my group practice. I just had a group practice because I wanted to have a group practice. Okay. So your practice will go through different stages. But absolutely, licensed people can look to join group practices depending on what you offer. So I'm going to give you another tip on what you can offer and what you can provide to a licensed person. But first, I want to thank our sponsor, TherapyNotes, who has made it very easy for us to add licensed people, for them to supervise other people. Again, for us to run the credit cards, they have an auto credit card processing now. To write notes, Therapy Fuel, we love it. We're happy with it. We're excited that it was rolled out. Sending assessments, looking at values-based care. There's a lot of things that TherapyNotes offers. And if they run into any issues, we're like, call TherapyNotes. They pick up the phone, they guide them. They have been wonderful with customer service. So thank you to TherapyNotes. The other thing that we offer licensed clinicians is a pathway for leadership. Right now we have, I'm just like, think, 8, 9, 10, 11, 12. We have 12 leadership positions that are filled by our licensed clinicians. 13 actually, because I forgot we added one. So we have 13, lucky number 13. And every time we add a new location, we put a lead there. When we add new services, we put a lead there. When we are looking for expansion, like we have one clinical director now, she's overseeing 8 people. Probably after, if we, once we grow a little bit more, we're going to have 2 clinical directors, because that's going to be maybe an opportunity for somebody. And so there's a lot of opportunity for growth. At least we try. And we want to help mold leaders into being a team player at Caring Therapists, because I think leadership opportunities are really important. And so we try to fill them up, make it easy for them. And for those that want, we give them leadership opportunities. I hope this was helpful. I'll see you soon, everybody. Bye.